Welcome to the Perry Health Pulse podcast, a program dedicated to taking you behind the scenes of healthcare, sharing firsthand knowledge from healthcare professionals, and putting you in the driver's seat on your journey to lifelong health and wellness. Listen and learn about how healthcare delivery is changing on our weekly podcast.
October is Breast Cancer Awareness Month. Today we're going to spend a little bit of time talking about mammography and what all that involves, what's the difference between 2D and 3D mammography, and why it's really important for women to have mammograms. Our guest today is Pam Jackson. She's actually worked in radiology for more than 20 years and has done mammograms for 23 years. So she's got a lot of experience in it. Thanks for joining us, Pam.
Hi, glad to be here.
Starting off, can you explain a little about what a mammography is and how it works?
Well, a mammogram is basically an x-ray of your breast tissue. So just to kind of make it real simple. The process that the patient will go through when they get here is they come into the room. The technologist, we take them back to our mammogram suite. We have a specialized suite that kind of makes it feel a little bit more not hospital-like. And so we'll go sit them down and we'll go through their history and make sure there hasn't been any changes or that we need to update anything and kind of go through if they're there for a problem or if it's just a routine exam. Then we'll step out and let them change. And then when we come back in, what we'll really do is we'll position them in a couple of different positions and then take some images. We check them on our mammogram workstation, and we make sure that there's no motion and that we have the proper positioning, and then they're free to go. If they're there for a problem, the doctor will come in and talk to them. But if it's just routine, then they're in there maybe 15 minutes.
And then I assume get the results later on.
It depends. If they're coming for a problem, they will definitely get those results the same day. Okay, they're scheduled for that. They're scheduled with time with the radiologist. So they're not going away going, okay, now what? They actually get some answers that day. If they're just coming in for a routine screening, sometimes we'll schedule them on a day when we don't have that specialized breast specialist there to read them. And then so when they come in, then they read them and a letter goes out to the patient.
Okay, so they do receive it by mail.
Oh, yes, but everyone gets the results by mail. Even if the doctor has come in and talked to them, they're still going to get that letter in the mail.
Now, there is both 2D and 3D mammograms. What's the difference between those?
The 2D is kind of the old way of doing it. It's a flat image. It does show all the breast tissue, but it doesn't have a whole lot of detail to it. Like, the challenge comes in when the detail that is there is stacked on top of each other. So then the radiologist has to decide whether an area is a true lesion or whether it's just their normal breast tissue. So there's really no way for the radiologist to manipulate the image. And so that's a reason for a lot of the callbacks. If people have a lot of dense tissue and it's stacked up, it can mimic something that is there when it's not really there. So then they have to come back and it takes additional time and worry for the patient. Which brings us to the 3D, which is the machine is actually creating a three-dimensional picture of the breast using the same x-rays and the same views that we would do with the 2D positioning. The difference comes in that the radiologist is actually able to scroll through the breast tissue layer by layer, and Perry's 3D machine that we bought actually is taking pictures of the breast in 1 millimeter increments, like all the way through. So when the doctor's looking at it, he can see all these fine details because they're no longer hidden by the tissue that's above it or below it. We like to liken it to looking at a book, where like the 2D is you're looking at the cover of the book. You can turn it around, but you're still really just seeing the outer part of it, like on two different pictures. The 3D is like, okay, you open the book and you flip through the layers of it. You're looking through the pages. You can see the different details in the breast, and it eliminates a huge amount of callbacks, and it's really given technology and the upper hand on getting ahead of breast cancers.
Now, is there a difference in the actual patient experience when they're getting the imaging done?
Well, one of the differences that they're actually going to know, there's only really a couple, is in the actual picture taking of it. The mammo machine is actually going to move in an arcing motion, basically around their breast. This positioning is the same, unfortunately. The compression is the same, but the tube is actually going to move. And you'll have to hold your breath for about 4 seconds, which for most people is not a problem. And if you can't, we just ask that you hold real nice and still because there's motion. We don't want to blur any fine details with that. This machine also has, I've heard a lot of people say that it's more comfortable than the 2D machine. And I think it's because we have what we call a fast paddle. And this paddle has rounded edges on it, and it actually flexes and conforms to the shape of the breast instead of just being like a hard plate that comes down and compresses. This one actually will flex to it, and it doesn't come down hard and as fast as the old one used to.
How important is it for women to have mammograms? How often should they do it?
1 in 8 women are going to be diagnosed with breast cancer, which is absolutely huge. It's 75%, and I won't get into too many numbers, of those women that are diagnosed are of average risk. They have no family history and nothing that is a high risk. So you hear people say, well, I don't really need a mammogram because I don't have any family history, or I'm not having any problems, I don't really need to go in. 75%, I mean, that's huge, have no family history. Like, they are the beginning of it. So we want to find the cancers while they're still small and they haven't spread. So this gives the patient a larger range of treatment options and a better chance of survival if you're going to catch it before you feel it.
Well, medicine today is all about catching things early. The earlier you can get it, the much easier it's treated and managed. And
oh, definitely.
It doesn't have to be something that's scary.
Exactly. A lot of times that we'll do biopsies here in our department, and it's just a quick little needle biopsy. You put a Band-Aid over it, and they're good. It's not the big surgical procedure that it used to be years ago.
So when should women start having mammograms?
Decisions about when to begin and how often to come has always been confusing for people. It's been confusing for many years, and it just depends on which medical organization that you're actually listening to. There's always going to be some variance in the guidelines. Our department, which is governed by the ACR, American College of Radiology and Society of Breast Imaging, states that all women of average risk, and we're just talking not women that, my mother had breast cancer when she was very young, no immediate family, just average risk. We're saying 40 is the appropriate age to start screenings. And then we want to see you yearly after that. Of course, there's always going to be circumstances when your doctor may want you to start screenings earlier, like in your 30s. And that depends on your risk assessment, and you and your doctor can talk about that. There's different assessments that you can take to determine whether you need to start earlier. But 40 and then every year.
So is there an association between family members getting breast cancer?
There is. Well, if you have a first-degree relative that has breast cancer either at an early age, or we actually categorize it in pre or post-menopausal. So if they were pre-menopausal and your mother or your sister or your close relative, like an aunt, first-degree aunt, has had breast cancer pre-menopausal, we want to see you earlier than that. If you have had the BRCA gene or a gene mutation come back positive that you had tested for, we want to see you earlier than that because you're at a higher risk. So you're going to start your screenings earlier than 40. We do not screen men. We do, actually, in our community, we do a fair amount of men every year. I mean, it's probably maybe 12 a year. And that's pretty huge for our community. To actually have a man come in, he would have to have a problem. We don't screen men. Most men come in and they either have a lump or some really tenderness and pain in their breast. And in that case, we kind of do an abbreviated version of a mammogram. We don't really need the 3D on men because we're not really looking for that type of a thing. We just want to see is the tissue swollen. And a lot of times they'll go straight to ultrasound after that. So men do get breast cancer. We just don't screen them for it because it's rare.
Let's pause for just a moment to hear a message from today's sponsor.
Accidents happen. So do life events. Trust our surgeons' hands at Perry Memorial Hospital. From beginning to end, Dr. Godboli and Dr. Williams make it easy to understand. From a complete description of your procedure, to the expected outcome, to post-surgery rehabilitation if necessary. We care, we listen, we are Perry, with clinics in Henry, Walnut, and Prompt Care in Princeton.
With the 3D mammography, how early can it really detect breast cancer?
It is actually proven that a 3D mammogram can detect breast cancer at least 15 months earlier than conventional 2D used to. So the greater accuracy means better detection. I mean, 15 months, that's huge. If you wait for longer than a year, something could not be there 1 year, and then the next year you come back and it could be, oh my gosh, there it is. And we've seen it hundreds and hundreds of times. Like, there it is, and it's only been 1 year, and these are people that are coming every year. So we want to find these things before you can feel them, before you're symptomatic. The sooner you find it, the better your treatment options are.
15 months is huge.
It is. Some cancers are very fast growing, and a year can make a huge difference. Most of them are not fast growing. There are little calcifications in there, or you've got a tiny little speculation that you're never going to feel these things. You want to find those, get them out of there, get them removed so that they don't spread, they don't infiltrate into other parts of your body. Some cancers in 1 year, we've seen this happen too. Somebody comes in, they just had their screening. 6 months later, hey, I got this lump, I've got this pain, and you've got something that is just, it's crazy. So it just depends. Different tumors can grow at different rates.
Now, is a mammogram something that people have to have their entire lives? Or is there a point where they can stop doing them?
We get that question a lot because they're always, hey, you know what? When can I stop these? I'm getting older. I feel like I'm out of that range where I need to come every year. Here is the actual answer to this. The ACR, American College of Radiology, Cancer Society, everybody here is what they're saying. If your overall health is still good, and that's a big thing. If you've got bigger issues than a screening mammogram, that's different. If your overall health is good and you have a life expectancy of 10 years or more, okay, you're good health, you're going to live at least another 10 years, we want to keep seeing you. The other issue the other point I want to make with that is if you are willing, you have to be willing to undergo additional testing, including biopsies, if an abnormality is detected. If you're going to come for these screenings, but if they find something, you're not going to do anything about it anyway, or you're not going to be able to go through a biopsy type of a situation, the whole point is to find these cancers and get rid of them. If you don't really want to do anything, or you're at a point in your life where you don't want to do that, then you don't need to be putting yourself through the screenings.
Now, let's talk a little bit about Perry specifically. Obviously, mammograms are something that you guys do year-round as people need them or as they just feel that they need to get another screening done. But October is the big month, being Breast Cancer Awareness Month.
Yes, it is.
So what are you guys doing specifically this month, or what are you offering to entice people to get those screenings?
Well, our big theme this year is strong mind, beautiful heart, fierce soul. So we have made up some shirts that we are selling, and they are still available, but they're only through October 11th. If you want to come to radiology, we have a display. You can see t-shirts, sweatshirts, hoodies, and they have a big, beautiful butterfly on it with a breast cancer awareness, and then that nice saying on there. And we're also giving out, if you have your mammogram in October, we're giving out these nice eye masks. They're hot and cold. They're nice and soft on one side. We're also giving you out a nice lip balm. So, we want to see you. You don't need an order to have a screening. You can just call and schedule. We'll work you in. If we're busy, a lot of times scheduling can call us down in the department and say, hey, we got this lady. She really wants to get in. And we'll work you in. You don't, like I said, you don't need an order. People get confused by that. You just have to give a provider that you want the results to get to in case something is abnormal. Someone's got to be able to get a hold of you.
Fun giveaways if you get your mammogram done this month. And then with the shirts, like you said, that you can order them through the 11th. What's the money from that going towards?
That is going towards the Believe Foundation, and it's also going to the Pink Ribbon Club. and they provide a lot of help with wigs and car care and rides for appointments, prosthesis, scalp treatments, a lot of good information, support groups.
A lot of good local support.
Definitely. And they're also, the Pink Ribbon Club is having a Let's Rip Up Cancer fundraiser at obviously at RIPS. And that's on October 28th from 5 to 8. So if anybody's interested in that, the proceeds go toward the Pink Ribbon Club also. So.
And with all this information, the event details and all that, we'll put that on the webpage with this episode. So if you go online to www.perrymemorial.org/podcast, you can find this episode. You can find those details. We'll put the number to call if you want to schedule a mammogram. We've also got a lot of pink nights coming up this season, getting involved at the area high schools. So lots of awareness getting out there. Hopefully women take note and get breast cancer screenings and come and see you, Pam.
All right. That sounds great. We'll work you in.
Thank you very much. It doesn't stop here. Access other podcast episodes and resources related to today's episode by visiting www.perrymemorial.org/podcast.